When you think that you've got nothing left and you start not to care, just remember about the friends you have and the love they have to share. You see, we spend our days out picking and jumping in the bins, playing this game that by the end of the day the one with the most wins. Sometimes we enjoy the sunshine and wait for the sun to go down, and as darkness falls and the fires are lit, that's when our friends all come around.
There's no question that what's happened to me has shaped the way that I'm built. My mind is built and will be built for the rest of my life.
It's the most awful thing to be sick and not be able to get help and hear the word no.
It was awful. It was awful to be treated like that because I'm going there and all I want is some help and some support.
Remember about the friends you have and the love they have to share.
It was the best feeling I had ever felt. I was warm and comfy and everything was funny and I felt so good, and I had never felt that before, like from any other drugs. Never felt that feeling of like just like nirvana almost.
Mother was terrified.
Yeah, it was pretty scary being on the street. You have to worry about being robbed, being sexually abused, being taken control of, and I was quite naive when it came to the whole process. So he was the first one to inject the heroin into me, and I was like, I don't want to know how to do this. I don't want to, like, it was always that line in the sand. I don't want to use needles, right? But once you cross those lines, it's so much easier to cross every other line. And of course, a few weeks later, he's like, I'm not doing this for you anymore. You have to do it yourself. So I learned how to inject myself with the drugs. There was an incident at my mom's house once. We were told that there wasn't any heroin around, so I took a Seroquel, which is a medication that lowers blood pressure, but it also helps with opiate withdrawal. So I had taken one of those, and it lowers your blood pressure, thinking that we weren't getting anything, and I wanted to sleep that night. And we ended up picking up, and I remember cooking it up in the needle and everything and saying, there's hardly anything. I'm not even going to get high off this. And I did my shot, and I sat down on my bed, and I ended up ODing. Well, I've had a few experiences going to like the emergency rooms and stuff and just being treated like total crap. Because I'm a drug addict, I am lower than low. And it was awful. It was awful to be treated like that because I'm going there and all I want is some help and some support. Like one instance, I went there and I hadn't slept or eaten in a few days. I was withdrawing. I hadn't had any drugs. And I was like, I just want to get help. Like, can you just give me like an IV with saline solution because I'm dehydrated. I haven't slept. And they asked me a bit about my story, and I told them, and doing that hurt me in the end because I wasn't seen by a doctor. I was there for like 6 hours, and they had given me a bed and waited, and all they would give me was warm blankets. Like, they couldn't even give me an IV. They wouldn't even, I was just a burden on them. And I ended up leaving and using drugs in the bathroom because I was so sick I couldn't even walk to like a gas station. Because I was just there to drug seek, even though I wasn't. All I wanted was some support. I could get dope way quicker than I could in a hospital. And I understand that there is some cases like that, but the majority of the time it's not. They're there to seek help and there to reach out, and hopefully someone else will have a hand for them to reach out to. I went to Aventa and I completed the 6-week program there. And once I left treatment, I had relapsed because my addiction is to drugs and alcohol, but also to relationships. So I would go from relationship to relationship to relationship. And then I met a few people that like went to AA and went to NA, and they talked about doing the steps and stuff. And that's what really like I saw them and I saw that they were happy and all this stuff, so I really decided to give it a try. And yeah, it's made my life amazing. Like, I have a home now, I have a dog, and I have a cat, and I've been with my partner, who's also in recovery, for 3 years next month. And yeah, like, there's been some ups and downs, of course, but my life is recovery, and like, I have a life now, and it's quite amazing.
A few more sentences, see, like Wifey used to write me just a few short sentences. Just a few short sentences.
So I do outreach with the program. So I work with a lot of different agencies. So I go to Alpha House, I go to the DI, I work with SOS, with Canadian Mental Health. I go out in the Safe Works van. I'm helping as an ex-drug addict. I'm helping as a female. I'm helping. It's just being there for someone and giving that someone that some time and eye contact, because a lot of this population is just looked down upon. It could be the crappiest day and I could be in so much self-pity and hating life, and go out and do pure outreach and feel not a million times better, but I felt better because I'm giving back. I'm helping people where I was using those services. I needed those people, and now I'm that person that's able to give that back.
The love showed me that I didn't have enough, but when I finally gave in, I took my hands off.
I started in Prince George, had my own business up there, and I was waiting for a job to transpire, and it never did.
He took control, then he took all I had.
I was pretty naive those days, and I said, yeah, everybody smokes in my place. But I meant cigarettes. First time I've seen cocaine from about, our distance apart. I've seen it on TV, but never real up live. And as the night went on, they kept offering it to me, and I kept saying no. And then about midnight, I thought, I preach to my kids about drugs, and I have my own business. I can manage this. And they look like they're having a pretty good time. I'm going to try it just once, just for my own curiosity. Well, I did it once. I'm reaching into my pocket. Here's $200. Bring me back some next time you go. Yeah, well, I was on the streets for 13 years. And I got picked up on tickets for C-train, spitting on the street, jaywalking, stuff like that. But they pick you up, and they give you a ticket, and you know you're not going to pay the ticket, but they don't take you to jail right away. They wait till you build up about $2,300 so they can hold you from between 30 and 60 days.
Then I found myself alone.
Every November would come along, I'd go to a treatment center and stay there until March, while it was cold outside, then they go back out. But when you get out, there's nothing for you to do. You have to survive, so you go right back to where you are. Well, it wasn't a 5-star hotel, but I had all the food, heat, and drugs I wanted. All I had to do is sell. So the drug dealers were willing to help me, but Alberta Works wasn't. So then I went to Salvation Army Family Find to see if I could find my daughter. And in February, they took all the information, and I didn't hear anything till May. And they said, well, that's strange. And I said, what's strange? She just got off the phone with us looking for you. You gotta excuse me, this is where I get a little bit emotional sometimes. Because what are the odds of two people looking for each other at the same place at the same time?
Bad timing, but I never felt more like singing the blues, 'cause nobody loves you when you're down and out.
When I was 22, my youngest brother was killed in a rig accident, and 8 months later my dad died of a massive heart attack. And it was really strange. You go from a family of 5 to a family of 3, and it took me a long time to really adjust to the fact that my family had changed. About 7 years ago, what I say, lightning struck again twice in a lifetime. In a billion cajillion years, I would have never predicted that I would lose my older brother to cancer. Let's take a moment here. Because he was like my rock, and my dad was gone, so he walked me down the aisle, and he used to say, "Hey kid, my little sister, when mom's gone, we'll have each other." But what made things even more difficult, unbelievably, my mom got critically ill at exactly the same time. And I used to think to myself, well, why can't I manage my stress? Wasn't I raised properly? Why am I worrying all the time? Why can't I sleep? Why am I depressed? Well, and it seems unbelievable. My uncle, that was also a school teacher, we were very close, and he lived in Calgary. Well, 9 months after my brother died of cancer, my husband and I found him in his apartment. He had a heart attack and he had passed away. And I did get help from a family physician, but unfortunately he prescribed a medication called Paxil, and it triggered a severe manic episode. And I'll never forget, I got put into the car. They somehow talked me into getting into the car, and I reached, and there's no handle, and then I started to panic, and unfortunately I had to get dragged into the hospital against my will. I could still feel their grip on my arms, and I was put into triage, and that's a different area for mental health patients at the Rocky View. And unfortunately I was locked into a room. I had to sleep with my clothes on until a bed was found. It was the most traumatic, humiliating, demoralizing thing I've ever been through. I was released without proper follow-up care. I was released to a physician, but I needed psychiatric follow-up. Trying to find a psychiatrist is just about impossible. I phoned the Rocky View thinking, I'll just phone the mental health ward, and they'll help me out, no problem. Well, no, we can't help you out. You've been released. Phone outpatient. Well, I'd phone the outpatient program, and then they told me, well, there's a 9-month waiting list to see a psychiatrist. It's the most awful thing to be sick and not be able to get help. I had it all. I was living the dream, right? House in the suburbs, and you can travel, have the money to travel and see the world, and the 2 cars and the dog and the daughter and friends, and yet I felt so isolated and alone, because unfortunately my husband and my best friend, and she was a nurse, interestingly enough, they didn't know any better. They covered up my illness. They kept saying, well, just take your medicine and you'll be better, Kathy.
My breakfast for some insight to his past. What was his proudest?
The person that gave me the worst care was actually a nurse. And all I'm going to say, it had to do with my ongoing care after I was released for the hospital. And what I will say is that she missed the opportunity to help someone that really needed the help.
It was 69 just down the street in Mr. Carnegie's hall. 'Cause you never know.
It was so encouraging to feel I could share my story. I didn't feel quite so alone or quite so isolated. I used to think for the longest time I wasn't going to let my illness and what happened define my life and who I was. But in fact, it did define my life, but in a very positive way.
Well, my name is Chelsea Major. I'm 28 now. I have a degree in behavioral sciences with a double major in psychology as well. As I started having mental health concerns, my parents identified it in grade 3. So I started self-harming by the age of 9. I had a full-on eating disorder by the age of 14, and I was a full-on alcoholic by the age of 16. But I was hanging out with the wrong group of friends, and they're like, Chelsea, why don't you come out with us? And I was like, okay, I'll come out with you guys. When I had one, I couldn't stop, even if I wanted to, and I tried. And I couldn't stop. I started getting psychiatric admissions starting in my late teens to the point where I've had over 28 suicide attempts.
I want these stories told, so I'll lay them on the line.
I got diagnosed at 21 with borderline personality disorder. I was Hallmark. You could have put my picture beside the DSM diagnosis. It would have been Chelsea in a nutshell. I'm a very emotional person. So if everybody has emotional scale of here, I have an emotional scale of here. Right. And so for me, when everybody else is putting around in Hondas downtown, I'm racing around in a Formula One race car because I don't know how to keep my emotions in check. I hadn't been taught. So from a mental health standpoint, when they first told me I had borderline personality disorder, amongst a few other things, I told them where to go and how to get there, in some very four-lettered terms, because I was like, there's no way that someone like me would have a personality disorder. I have horror stories of being in the ER and being told, well, why don't you just kill yourself? Like, you've been here so many times. And then eventually it got to the point where when my dad passed and everything else like that, I went into drunken stupors and it wouldn't come out. And I would steal my father's pain medications, so used everything up from T3s to fentanyl and everything else like that. And I'm not proud of what I've done because I've done a lot of horrible things for my addiction, but I didn't know what else to do.
I get up.
So I had to wait 11 months to get into DBT, so it's dialectic behavioral therapy. Right. And at that time, I was using 7 different services. So I was using the mobile response team. I was using the community, not CRT, community extension program. I was at ADAC. I had a counselor. I was in the hospital. I was at Rockview Day treatment. I was everywhere but where I needed to be. Right now, our system doesn't function in a way that helps people. It puts people on a wait list, and I was just as sick as quite a number of other people, and I just had to wait my turn.
Yeah. $1 an hour, 2 bits a mile. A lot of time.
Actually, as of Friday this month, Friday this week, I will be 6 years self-harm free. And in June, I'll be 7 years clean and sober. But it's one of the hardest journeys I've ever had to take. So since then, I returned to school. I finished an honors degree and did an undergraduate thesis in looking at the stigmatization of mental health professionals.
Standing in line. I've worked for less. I measure success one time at a time.
Your face is the door. Your hand is the handle.
I mean, I think that what I've learned and what I know is that I think one of the gaps that we have is the lack of knowledge around the impact of whether it be adverse childhood experiences and the connection to mental health and the connection to suicide and how most of the invisible impacts are connected. And I think that, we always say that our best defense is knowledge. And I think that if we can educate ourselves on, the impacts and look beyond just the presenting issue. What we know around trauma-informed care is that a lot of the times trauma-informed care, and the way that I break it down, is really about connecting the dots and painting the picture, which ultimately is looking at the whole person.
And I can see it happening in that we get busy with our jobs, we're seeing hundreds of patients, and sometimes you forget about the individual patient. You're trying to get all those hundreds through. However, that being said, you have to sometimes recognize the person before the patient and put yourself in their shoes.
The goal is to really shift the question from, what's wrong with you, to what happened to you.
And just to be open-minded and maybe listen to the person for 20 minutes to see why they're there, not just assume, right?
Compassion. Compassion is the big thing as care providers. We have to go in and check ourselves at the door.
That a little bit of caring and understanding can make such a difference. And we forget that sometimes.
One of the biggest things is, I haven't mentioned before, is to be genuine. Because there's a lot of times you're not going to have the same experiences as they do. We all have emotions. I'm human too. I can relate to sadness just as you can relate to sadness. Just as someone experiencing homelessness can relate to sadness. So if I can be genuine with them and go, hey, you know what? I flat out don't understand what you're going through, because you don't. But I know what it's like to feel emotions. Having that transparency is one of the greatest things.
There's no question that what's happened to me has shaped the way that, I'm built, my mind is built, and will be built for the rest of my life.
Just being there for someone and giving that someone some time and eye contact, because a lot of this population is just looked down upon and not even given that simple thing of looking someone in the eye and asking them how their day is, talking about the weather. It has nothing to do with you're homeless or you have mental health issues or you're addicted to drugs or alcohol. Like it's you're a person and you deserve to be treated as such. So that's what I'm going to do.
Home was your womb, and then when you read Winnie the Pooh and Robinson Crusoe, home was a tree and a tropical island.
Accept addiction for what it is, and if you witness people harming themselves, then step up and say, you know what, there's a better way to do that. But you're harming yourself, or ask them. Say, well, why do you do it that way? Why?
Harm reduction saved my life. So whether I am in an abstinence-based program now, harm reduction still works. You're in healthcare. Harm reduction is part of healthcare, and you need to use that in whatever aspect you can, right?
And the patience of allowing people to be themselves and go through what they're going through. And the best thing about harm reduction is that it's guilt-free. So, we don't say, oh, you had to slip and you have to start all over again.
Because harm reduction works. It's not just clean needles and it's not just condoms. It's wearing a seatbelt, wearing a life jacket when you're in the water. Harm reduction is not just needle exchange. Harm reduction is education. Harm reduction is listening to somebody and meeting people where they're at, no matter what that looks like.
Well, I think, healthcare providers really, really try. Really, there's a lot of really good, educated people that work hard.
I just want to say thank you to everybody, all the young nurses that are taking the step to help others. I think it's important. I think it's very rewarding. And I think that the difference that you can make in a person's life is very significant.
Nurses, you have a lot of power to make a difference.
And I want to say to nurses, doctors, all those, just treat people the way you want to be treated. That golden rule. People are people, and we're all suffering with something. We might have trauma or poverty or mental health or whatever, but you need to treat people like human beings, whether they don't groove with how you feel about life or whatever.
You look like you're broken. I see that you're choking. You're sick and you're tired. And you're way too hurt to cry. You're not feeling the need of some healing. Come sit by the fire. And of the pain that's in your heart, we're here to support you, to shine a light for you. The whole world, we need you to find yourself again. Come let me love you, to feed you and hold you. Just step inside, we'll be your shelter.